As a certified hand therapist, you focus specifically on the upper extremity, but primarily on the hand, because the hand is such a functional part of the body. We all use our hands for everything. Even a minor injury can be quite limiting functionally.
When she's flexing it and you pull down and then you go the other way, there's a lot of pain there. But the more and more we're doing this kind of stuff, the less of that pain there is.
It's important to have a therapy designed specifically to focus on whatever may have limited the hand in the accident or the injury.
I do notice that on days I don't do therapy, I notice the problems with a lot more.
The neuro patients that tend to be more stroke and brain injuries, those people tend to be treated more over at the hospital. Here, the hand typically the injuries tend to be more orthopedic, broken bones, lacerated tendons, nerves, that type of thing.
They told me I could probably get 80% of it back, and I wanted 100.
When he comes in, he gets heat. What we're trying to do is fight the scar tissue that's developing from his injury, and the scar tissue tends to create adhesions, which limits his range of motion. So we want to warm the scar tissue up, which is primarily made of collagen. And if we warm him, we typically use a whirlpool. Sometimes people need a deep heat, which is an ultrasound, because he has a deep scar tissue as well as superficial scars. And we warm those up, work on soft tissue massage to loosen things up, work on stretching, range of motion, and then he'll get into some more functional activities using the hand functionally after it's been warmed up.
We've just made such big strides.
It's painful when you start stretching them out, and that's why we try to use the heat to make it as comfortable and as effective as possible. The tendons that he injured were on the back of the forearm and the hand, and so you're typically very tight trying to restore flexion. Making a fist is always a struggle, so that's tight, and that's always what we're trying to stretch back out to get, because functionally you want to get that fist back.
Well, if it gets easier, she pushes harder, but yeah, I mean, we've just come so far.